please describe the difference between PAH and high blood pressure?
Definitely. This is one of those confusing things where we're talking about sort of two different systems within someone's own body. And for me, that doesn't even seem to make sense, right? How can you have high blood pressure one place and low blood pressure another, or vice versa? And so one of the things that I try to remind all my patients is that when the majority of physicians or patients or caregivers are talking about high blood pressure, they're actually talking about the blood pressure that you measure in your arm, like when you go in to visit your provider and they get your vital signs and they take your oxygen and they take your heart rate, and then they put the blood pressure cuff on your arm and they measure your blood pressure. And that is what we think of as your systemic blood pressure. That's your body's blood pressure through the arms, through the legs, up to the brain. But we have a different blood pressure that comes from the right side of the heart. And this is very distinct. It is just the right side of the heart, and the blood vessels in the lungs are under what we think of as a low pressure system. So I'll give you examples in terms of numbers. When we talk about a normal blood pressure in your arm or your body, we usually give the numbers of 120 is the top number, and then the bottom number is 80. So people, when you get your measurements, often someone will say, oh, yours is 130 over 85. That looks like a great blood pressure. When we're measuring blood pressure in the right side of the heart and in the blood vessels of the lungs, the actual normal blood pressure is more of 30 over 5. So you can see the huge discrepancy between the blood pressures. And it is, for me, just incredibly amazing how the body can function under two systems of blood pressure, one inside the chest and the other for the rest of the body. So you can have both high blood pressure in the body and in your arm and high blood pressure in the blood vessels in your lungs. Many of my patients actually experience something different. They experience high blood pressure from their pulmonary arterial hypertension, but actually when their doctor measures their blood pressure in their arm, it's actually what they are considered low blood pressure. And sometimes that can be a problem as well for our patients. So I think that the question is tremendous. Trying to get your head around the fact that we can have two different pressure systems in our body is important. And that when we as PAH specialists are looking at blood pressure, it's really specific to the blood vessels of the lungs.